Hello and welcome, everyone. All right, let's get started. Thank you so much for joining me today. I am Dr. Nicole Smith. I'm the founder of Anti-Gravity Wellness, and today we're talking about a topic that hits close to home for so many women over 35: skin and hair changes during perimenopause and what you can actually do about them. So, if you've noticed more shedding, dry skin, or just feeling like you're aging faster than you should, you're in the right place. Quick medical disclaimer: it's only for educational purposes. You need to consult with your own provider. So, a little bit about me. I am a board certified nurse practitioner, both in family practice and orthopedics, as well as a certified personal trainer. I'm also going to be sitting for the menopause board examination in October. I've worked in acute care medicine, but now I specialize in hormone health for midlife women through my telemedicine clinic, Anti-Gravity Wellness. We serve women across Washington and Oregon State and beyond with a root cause, whole body approach to hormone balance. Think labs, lifestyle, nutrition, movement, and support, all tailored to you. Let me introduce you to someone we'll call Lisa for the sake of privacy. Lisa is 44. She came to me feeling exhausted, frustrated by patchy hair loss, and noticing that her skin just felt thin, dry, and prematurely aged. She had already tried every shampoo, oil, and cream out there, but nothing was working. When we did a full workup, we found low DHEA, borderline low estradiol, low ferritin, and a zinc deficiency. We focused on increasing her protein, replenishing her nutrients, supporting her adrenals, and adding BHRT, or bioidentical hormone replacement. Within 3 months, her skin was noticeably plumper, her hair started growing back. And the biggest change was her confidence was finally back. That's no small thing. So the problem, what Lisa experienced isn't rare. It's the norm for so many women entering their late 30s and 40s. Suddenly, your skin feels dry, dull, or saggy. Your hair doesn't grow like it used to, or it starts falling out in the shower. These symptoms are often brushed off as just aging, but they're really signs of internal shifts, especially hormonal ones. Here's what's happening under the surface. Estrogen drops, and so does collagen and skin hydration. DHEA and testosterone decline, weakening hair follicles. Cortisol increases with chronic stress, which steals nutrients like zinc and biotin. And thyroid dysfunction, so common in midlife, slows metabolism and impacts both hair and skin quality. So when you're told to just take biotin, that's a surface level solution for a deeper issue. Before we even talk about supplements or prescriptions, we have to address the lifestyle foundation. Sleep. Sleep is your body's repair window. You want 7 to 9 hours a night, ideally with deep sleep between 10 p.m. and 2 a.m. Stress drives up cortisol, which disrupts your hormones, your skin, and hair growth. Incorporate things like breath work, journaling, or gentle movement. And speaking of movement, resistance training helps build circulation, stimulates collagen, and supports your hormones. Too much cardio, it can actually backfire and spike cortisol too much for too long. Now let's talk food, because no supplement or prescription can outdo a nutrient-poor diet. Start with protein, 1 gram per pound of ideal body weight. That means 4 ounces of protein like chicken, fish, beef, eggs, or tofu per meal. Then layer in berries for antioxidants, salmon and avocado for omega-3s and healthy fats, eggs for biotin and sulfur, leafy greens and broccoli for minerals and detox. This combination fuels skin repair, collagen, and hair growth. Hydration is another key that's often overlooked. As we age, our thirst mechanism weakens. So waiting to feel thirsty means you're already behind. Aim for 80 to 100 ounces of water a day at minimum. Boost absorption and skin benefits by adding electrolytes like Element, Ultima. Thorn also has a really great one that we just featured at our last event, or even a pinch of salt with lemon. Make it fun. Infuse water with berries, cucumber, or mint. Drink consistently throughout the day to prevent dryness from the inside out. Once your diet and hydration are in place, the right supplements can make a huge difference. Here are my top picks. We got collagen peptides with vitamin C, biotin, ideally in a full B complex, especially methylated forms. Omega-3s, we want 1,000 milligrams of EPA and 1,000 milligrams of DHA. Got to check the back of the bottle. Zinc, 15 to 30 milligrams per day with food. We don't want to overdo this one, but supplementing with it can be really helpful. If your alk phos is low, that could be a sign that your zinc is low. Vitamin D3 plus K2. K2 helps with absorption. We need to aim for a vitamin D level of at least 50, upwards of 60 to 80 would be preferable, especially for your bone health. And you want to make sure it's the D3 kind, cholecalciferol. That's the active form. A lot of people actually have a genetic variation that they will not make vitamin D3 as efficiently. Add into that, us here up in the Pacific Northwest, we just don't get enough sunlight. Definitely need to be supplementing with this. So start with 2,000 international units, upwards to 4,000 to 5,000 international units, and definitely get your vitamin D level checked. Adaptogens like ashwagandha to support stress response. These aren't miracle cures, but they support the systems that create healthy skin and hair. If you want my full supplement guide, you can comment below when you are on the social media channels. Okay. Now, sometimes supplements aren't enough. This is where bioidentical hormone therapy, BHRT, can be incredibly helpful. Topical estradiol can dramatically improve skin thickness and hydration. Micronized progesterone supports sleep, mood, and balances estrogen. Testosterone is helpful in select cases for women with very low levels and symptoms like hair loss or libido. And in fact, testosterone should be used more often with women. It's not FDA approved, so it's not as commonly used, but hopefully that'll change soon. Little tidbit, you actually have more testosterone in your body than you do estrogen, just way less than men do. So FDA-approved options include estradiol patches like Climera or Vivaldot, vaginal estradiol cream like Estrace, which honestly should be over the counter. Every woman should be using it in perimenopause and beyond. Micronized progesterone, Prometrium, which is an oral progesterone. Many of these are covered by insurance. If not, costs range from $30 to $150 a month, depending on what it is, compounded, things like that. Custom compounded blends are also available, but are likely not going to be covered by insurance. There are also other prescriptions worth knowing about. Rogaine, very familiar with this one. Generally marketed to men, but it can also be used for women. It's available as a 5% foam over the counter. It can help stimulate hair growth. Spironolactone, an off-label option used for hormonal hair loss or acne in women with high androgens, specifically DHT. That is the one that is more androgenic. We can run a Dutch test and see if yours are high. We can also check a blood level, but the Dutch test honestly is much better for figuring that out. And if you have PCOS, this is something that usually comes into play there. And then we can also use PRP, platelet-rich plasma, a regenerative option that uses your own blood platelets to stimulate scalp follicles. It's typically not covered by insurance, but can be effective when paired with lifestyle changes. I've also seen some ads for that red light therapy that you can do with your scalp. Those things have mixed efficacy, and they're very expensive and not covered by insurance generally, even within HSA. All right, so that kind of gives you a good overview of that topic. So what are your next steps here? First, you could join our free 5-day hormone reset, where you will discover real root causes of what's going on with your hormone changes and your symptoms, learn what your body is telling you, and start feeling like yourself again. So you can comment 1, 2, 3, or scan the QR code that you see on your screen. You can also go to our website, antigravitywellness.com, and you can get that. There's a banner at the top. You can click on that and get that free link. And if you live in Washington or Oregon State and you want more personalized help with your hormones from me, the nurse practitioner, you can book a brief initial consult call with me to discuss if hormones or another treatment option is right for you. And that's expired. Summer special is expired. This month, we're having a special where we will give you a wellness package, basically a welcome package with any sign up. You decide to sign into our services. All right. Well, thank you so much for being here today. Your skin and hair are not just vanity concerns. They are vital signs of what's going on internally. The truth is you're not broken, and this isn't just aging. You deserve to feel vibrant, strong, and beautiful, because midlife isn't the end of your glow. It's just the beginning. Thank you, and I will see you next time.